This is Community Connections, airing on OROMIA11. I am your host, Anna Orr, and today's guest is Dr. Brooke Cunningham. She is the Assistant Commissioner with the Health Equity Bureau over at the Minnesota Department of Health. We're going to talk with her about her new role, the work they're doing, and how we can better take care of ourselves as we head into the fall. This is going to be a wonderful episode with a lot of really good tidbits. Stay tuned.
daa'ima argachuuf karoora yookiin ulfa garaa qabdu moo deettanii harma hoosisaa jirtan dubartoonni ulfaa talaallii COVID-19 akka fudhataniif ogeessonni fayyaa cimsanii gorsu talaalliin COVID-19 dubartoota ulfaatii fi ulfa garaa keessa jiru irratti miidhaa cinaa akka hin qabne qorannoowwan garagaraa qorataman ni mul'isu yeroo ulfaa'anitti talaallii COVID-19 fudhachuun haadhaa fi daa'ima garaa keessa jiru vaayirasii COVID-19tiin akka hin hubamne gargaara. Haati daa'ima hoosiftu talaallii COVID-19 yoo fudhatte fayyaa isii eeguu biras dabree talaallii kana keessa qabiyyeen qorichaa fayyaa daa'ima garaa jiruuf daa'imni akka dhukkuba vaayirasii koronaa irraa eegamu gargaara. Talaalliin COVID-19 haawwan gara fuulduraatti ulfaa'uudhaaf karoora qaban kanneen ulfa garaa qabanii fi haawwan daa'imman harma hoosisaa jiraniif hedduu barbaachisaadha. Talaallii COVID-19 fudhachuun dubartoota ulfaatiif maaf barbaachisa? Dubartoonni ulfa garaa qaban talaallii COVID-19 yoo hin fudhatin dhukkuba cimaa isaanii fi daa'ima garaa jirullee haalaan miidhuu maluun qabamuu danda'an. Talaallii COVID-19 talaalamuu dhabuun ulfi garaa jiru xiqqaatee akka dhalatu taasisuu, ulfi garatti akka hafu taasisuu fi dhibeewwan garagaraatiifis akka saaxilaman godhuu danda'a. Akka qorannoowwan geggeeffaman hedduu mul'isanitti dubartoonni ulfaa'anii talaallii COVID-19 hin fudhanne dubartoota kaawwan caalaa dhibeen fayyaa walxaxaa ta'e akka isaan mudachuu maluu fi carraan dhukkubsatanii siree irratti wal'aanamus bal'aa akka ta'ee fi daa'imni garaa jirullee dhibeewwan hamaa garagaraatiif saaxilamuu akka danda'u ni mul'isan. Inumaayyuu dubartoonni ulfaa talaallii dabalataa yookiin buustar dooz talaalamuun carraa vaayirasii koronaatiin dhukkubsachuu isaanii xiqqeessuu akka qaban ogeessonni fayyaa gorsu. Dhiibbaan talaalliin COVID-19 fayyaa wal hormaataa irratti fidu jira laata? Namoonni tokko tokko talaallii COVID-19 fudhachuun wal hormaata irratti rakkoo fida jedhanii yaadu. Kun gonkumaa dhugaa miti. Ragaa qorannoo saayinsawaa tokkollee hin qabu. Talaalliin COVID-19 dubartoota ulfaatiif amansiisaa fi bu'a qabeessa. Talaallii COVID-19 irratti gaafiiwwan garagaraa yoo qabaattan gara buufataalee fayyaa isinitti dhihoo jiranii deemuun yookiin bilbiluun ogeeyyota dubbisuu ni dandeettu. Talaallii COVID-19 fudhachuudhaan maatii fayya qabeessa haa guddifnu jechuudhaan dabalataanis bilbila bilisaa 833 431 2053 irratti bilbiluudhaan odeeffannoo COVID-19 wal qabatu Departmentii Fayyaa Minnesota irraa argachuu ni dandeettu.
Thank you for joining me today, Dr. Cunningham.
Thank you for having me.
Can you talk to me about your role at the Minnesota Health Department and the work of your specific bureau?
Yeah, so the work of my bureau is broad, so let me try to give my best simple overview. So I am the new Assistant Commissioner for Health Equity. I've been at the Minnesota Department of Health for 6 months now, going on 6 months in a couple of weeks.
Congratulations.
Thank you. So I lead, again, their Health Equity Bureau, right? And when we say health equity, we're really talking about achieving optimal health for everyone, for all Minnesotans, regardless of their background, right? Regardless of their demographic characteristics, their race, their ethnicity, their gender, whether they have a disability or not. So I lead that bureau, which is new, and it has 3 core groups: Office for Diversity, Equity, Inclusion, an Office of American Indian Health, and the Center for Health Equity. But I'm in all of the agency's business, is what I say. So anything that MDH is doing, I really think about how it affects Minnesota's most vulnerable, most historically marginalized communities.
Okay. Now, we've talked a little bit about there are 3 different bureaus that you are actually over, right? And they're small groups within these. How do these groups work in tandem?
Right.
I guess would be a little bit more of a little bit helpful.
Yeah, so there's the Bureau, which is the overarching sort of organizational structure. Then there are those 3 groups within them. And then there are 3 other bureaus, right, at MDH,
I think this is the part that snuck by me. Okay. Thank you.
So there's the Health Improvement Bureau, which is about chronic disease, so our cardiovascular health, right? Injury, gun violence, opioid abuse, right? Child and family health, so maternal mortality, right? So that's in health improvement.
That's very important. All
of
those
that,
things named.
all of that. There's health protection, so that's like the safety of the water, right? That's like infectious disease. That's the lab. So all these COVID tests, right? That's the labs. And then there's health systems, because MDH does have a role with regulating health care systems or health maintenance organizations and the data for those groups. So I am in all of those spaces to the extent that my small but growing team can be there.
I like that. So prior to this role, because you told me that you just got here with it 6 months ago now, what were you doing prior to this?
So I came from the University of Minnesota Medical School. I am currently on leave in this position, right? So I was an assistant professor in the Department of Family Medicine and Community Health, primarily a researcher. So I am a primary care doctor, and I still see patients half day a week right now. I saw primary care patients at Kook Clinic, which is the Community University Healthcare Center, but I mostly did research, and really research on organizational behavior relative to health equity. So what are the impediments, right? We know the data doesn't change. We know which groups tend to be at the bottom in terms of health outcomes. Why aren't health systems more engaged was part of the question. And then helping providers specifically get engaged around racism as a fundamental cause of disease.
Now, I know that we've talked about 2 terms, equity as well as the Minnesota Department of Health.
Yes.
And I know that our entire viewership is probably not familiar with those 2 terms.
Yes.
So kind of let me just break down and give some definitions so that as we continue this conversation, people are able to navigate this a little bit better. So I had to Google specifically, what does the state health department do and what is their role? And according to Google, in the dictionary, Webster's dictionary, it says a state health agency or department of health is a department or agency of the United States government focused on public health. Equity is defined as the quality of being fair or impartial, freedom from bias or favoritism. And I think those are 2 words. That's a word. Equity is a very powerful word, especially when we think about healthcare and when we think about what the landscape has looked like for Black and brown people in the United States and abroad. So can you talk to me about how will the new Health Equity Bureau help our population?
No, I think there's so much opportunity, and in some ways that's unfortunate, right? Because history and ongoing contemporary policy decisions have created the conditions in which, when you look at all the upstream determinants of health that are related to, when I say upstream determinants, I'm thinking those things that started a long time ago that affect your health right now. So like your education, right? Your parents' employment opportunities. In the United States, we have a challenge with mass incarceration, particularly Black and brown communities. So children, and the Minnesota Department of Health, and I know we're going to get to that in a second, but the Minnesota Department of Health has some projects looking at children whose parents are incarcerated, because incarceration is an upstream determinant of health, both for the person who's incarcerated as well as for their family members. And so there are a lot of upstream or social determinants of health that at the Minnesota Department of Health, we have an opportunity to look at, to engage. And really what is key for my work in that is to engage with partners, right? Because it is the historical decisions, the historical policies, the historical disparate treatment that has led to disproportionate risk for communities of color in particular, disproportionate exposure to risk factors, and disproportionate resources really to address health needs when a disease occurs.
So you just talked about, so when a disease occurs, so right now we are dealing with monkeypox, COVID, polio in New York, and some other things that we haven't heard of in such a long time. And some of these illnesses, have taken place or have affected populations before most of us were even around. Polio is something that we have not heard of in such a long time. And I know, I'm sure like many others, people are trying to navigate what's sensible information, what should we throw out with the bathwater, so to speak, and then what should we be paying attention to. So I think it's important that the work of the Minnesota Health Department is breaking down things that are important to us and that are affecting populations in which we represent in a very specific way.
Right.
Can you talk to me about some of the main issues that you've heard about through the work of the Health Equity Bureau, besides what you've already mentioned?
Right. So you listed a number of things right now. You know, I'm in many meetings every week with COVID.
I'm sure.
Some additional meetings, you know, just sort of thinking about monkeypox and particularly our communication strategy about risk. But I'm in a lot of meetings with a lot of partners, with a lot of community groups, with a lot of folk across the state, so at other state agencies. Of course, I must say what comes up multiple times, time and time again, at this point is mental health. That's coming up a lot across all of those forums. And so we have to really think about the best ways that MDH can be supportive to address mental health needs in communities, because we can host conversations, but we also need concrete strategies about that.
I think mental health has been exacerbated throughout quarantine and people being inside or being in such close quarters with others, and then coming back, you know, COVID rules and regulations are starting to become more lax. And so people are then descending back into the public. And I think we're starting to realize that the numbers of people that are experiencing mental health are much higher than what we ever thought before. And I don't think people realize that they sometimes go hand in hand with other things. So encounters with the police or maybe behaviors at the school, things like that. And you're like, you think to yourself, something's taking place if you're encountering this, but you can't quite put your finger on it. So to hear you talk about, from a medical standpoint, all of these other avenues, and then to go, but the consistent thing I'm hearing from the public is mental health has to be addressed.
It keeps coming up, to your point. And I think, and what I like from what you're saying is that sort of you're lifting up all of the factors, or several of the factors that affect folks' health, right? It is living in a pandemic and the isolation that it brought, right? And a lot of times we're seeing that with kids in particular. It is the uncertainty. It is actually the loss, right? And particularly when we think about communities of color that have experienced, again, higher death rates relative to their population size, right? The loss of family members, of important community members, unexpectedly. And then there's just the stressors when we talk about inflation, when we talk about job security, when we talk about being able to get kids' needs met, to get partners' needs met, to get your own needs met. So I think we are in a time, and then just living in this world. So I think if you're like me, some just facts about living in this world: another shooting happens, right? Another mass shooting happens. Another shooting of an unarmed Black man or woman, right? These things take a toll every time, you know, because it doesn't stop, right? And much of it could have been avoided.
I think the ripple effect, I think, is that it is referred to, isn't always accounted for. We see something and then it goes away, and then something else comes, but we aren't always cognizant about the effect on how it's affecting our elders, how it's affecting our kids, how it's affecting teachers. You know what I mean? Other people in our communities, and some of these people are essential for our community function.
That's right.
And if they're not well, and if they're not feeling safe, happy, and whole, how do we have a safe, happy, and whole environment going forward? I think it's very important to start navigating. Can you talk to me as Assistant Commissioner about some of the work you're excited about at the Minnesota Department of Health?
So audience, Anna had to pull me in here because I kept talking outside. because I was excited. Anyway, sorry. So I think what I'm most excited are things like this, right? So I come from, I mentioned to you, I come from being faculty at the University of Minnesota.
Absolutely. Go Gophers.
We want to do more community engaged research, but often, particularly in a biomedical space, that can be a struggle. What I am most excited about are the relationships that I'm just starting to build, because I really think that relationship is important for impact, that community input is important for impact, to understand what are people's priorities right now, and then to really brainstorm, get creative, think outside of the box, do new and different things to close a gap. So it's really the people, people are most exciting to me in making these new relationships.
What would you say is a point of opportunity while you have heard what's been going on, or some of the issues amongst these different communities?
And yet it's so hard because it's so hard for me to identify one point of opportunity. There's so many points of opportunity. I will just say, how
about one that lights a fire under you specifically?
Oh, so many but I'll talk about that. But I go into community meetings, and what I hear from people, the whole meeting is talking about data and disaggregating race data, right? Because we have these big categories, 5 racial groups. All our reports are in these 5 groups, but we know that there are similarities within the group, as well as differences within the group based on the group's story and histories, right? And so the ability to maybe move data forward so that we get better data that we can share with community, that's exciting to me, right? The ability to highlight certain things. So we were just talking about incarceration, and we were just talking about the ways in which health effects affect everybody around you, right? So I can't remember your phrase, but a safe,
happy and whole
community, right? And I love that we do within the Department of Health maternal mortality, right? And I think they may be considering morbidity, so not just death, but adverse effects that happen when you're pregnant. But I also want us to think about women in their wholeness, right? In their wholeness as community pillars, right? In their wholeness of holding up the family, in their wholeness of being elders, in their wholeness. So it's not just that you are a parent, right? It is also who you are in your role, not only in the community, but also when you go into other settings, right, as a Black woman, right? And so how can we think about people and their wholeness, right? Not just these disease categories, which is what we tend to do in biomedicine. We think about cancer, we think about COVID, we think about heart disease, right? And all of these things, you can have multiple sort of conditions in a person, and you focus on this condition, and you segment that person out. But people are more than their conditions, right?
That's the truth,
right? Their wholeness, and so that is an opportunity to sort of think about not only data, not only sharing that data, but what are the stories that we tell about how that data got to be that way, and what our opportunity is to address that. So I think I am very excited about the potential to have great impact.
I think that's wonderful. Now, there are many programs and different hubs, I feel like, within the Department of Health, not just within our state, but how do you see them addressing the migrant population here with the East African community, which a lot of our viewership is?
Right.
So many of them are coming here and being raised by their traditional parents, and then step outside and live an experience that is very African American, whether it is at their school, whether it's on their job, whether it is encountering the police, whether it's going to the doctor. How do you see an opportunity where the Minnesota Health Department is able to help navigate some of that for parents as well as the community at large?
Right. I think it has to be, the way to navigate, I can't say that we have, again, the expertise at MDH, but we can be a convening organization, right? A lot of times in our history when we think about equity, the dominant narrative, there's several dominant narratives around why different people have worse outcomes.
Yes.
Right? There are lots of narratives. Traditionally, they lie a lot in individuals' behaviors, or people don't want to be healthy. They don't care about their health. They're making bad decisions about their health. And so again, when I talk about shifting the narrative, it includes really thinking about the structures, and we started talking about the historical policies that have set people up to have different health outcomes. And so when we think about the East African community in particular, it's very interesting. When I got here, I was doing a project in a large healthcare system, and I'm a new person in Minnesota.
Right.
I'm aware that Minnesota has a large East African community, and within the healthcare system, this particular healthcare system, I heard a lot of conversation about the Somali community in particular, and what I never heard was what it is like for Somali Americans, Ethiopian Americans, new immigrants of color to become racialized or to become black specifically in those situations. And so when we think about outcomes, and even when we think about mental health and well-being, what does it mean to be judged unfairly because of what you look like, because of your racial identity? And so I do think we have to do some deep engagement and some co-brainstorming and collaboration to sort of figure out where we can have a space, and then push on avenues where those conversations can happen.
I think that's very important. Now, if you are someone at home and you are watching this and you're going, this is all really great information, and I would love to talk to Dr. Cunningham, or I would love to stay abreast to some of the work that she's doing. Can you provide me and the public with a social media handle so that we can stay in touch not only with you, but also with the work that the Health Equity Bureau is doing?
Yeah, I need a better social media presence. I don't have one very much, but for MDH, it's MN, so Minnesota, MN Health.
Okay, so that's wonderful. So for everybody that is interested in more information or staying abreast as to what's going on with the Bureau, as well as how to navigate what's next for Dr. Cunningham, please check out that social media handle so that you can stay up to date and share with those around you what really matters. Next, I just want to talk to you about how has your work in academia, as well as seeing patients day to day at Coop Clinic and being a parent, affected your role as Assistant County Commissioner?
Thank you. You know, the top two are easiest, and I know the third one is affecting my role every day. I will say, so as an academic, I think I bring a lot. I'm a generalist, right? So when I say that I'm a master maybe of many things, right? And so I have broad-based knowledge of a lot of diseases clinically, and a lot of the ways in which upstream factors, so those social determinants of health, and particularly the ways in which they're racialized, affect health outcomes. And then as a clinician, I see it every day in clinic when a person may not have stable housing, right? May have not filled their prescription because they didn't have the money, when we talk about insulin and diabetes medications in particular. I have had conversations, so one of my projects, again, was to get providers, white providers, to start talking to their black patients about their experiences of racism. That was in part because black patients kept coming into clinic to me, sort of sharing those experiences, especially in healthcare. And so that broad-based, both clinical knowledge and really experiential knowledge, really makes me think, I think, in different ways and creative ways about methods to address health disparities. As a mom, you know, that's a great one. I think, again, I'm focused. So my daughter's 4, and I am really already sort of thinking about next year when she enters kindergarten, and I'm also thinking and very aware of the educational disparities in Minnesota. And you know, as black people, you have to show up a lot of times to advocate for yourself.
Yes, you do.
both in healthcare, but also sometimes in other segments of society. And so I'm already sort of thinking, is my child going to do well in school? I came up in Richmond, Virginia.
Okay.
I had a number of Black teachers who looked out for me. And I'm wanting her to have that same experience. I want them to see her light, right? And I don't want them to dim her light. So education is a key social determinant of health. And we know the statistics in Minnesota that we tend to be at the bottom, right, in terms of education achievement of communities, kids from communities of color. And so you've got to have a good education to get a good job.
That you do.
A job that gives you insurance in our society where insurance is tied to employment, right? A job that lets you have sick leave, right? Paid sick leave. A job where in Minnesota that has, it's at the top like 5 in terms of childcare unaffordability, so that you can afford childcare and actually go to work. So all of these things. And so I think as a mom, I really do think about the context of Minnesota. It emboldens my commitment to the population in this role, because I've been here. I finally bought a house. Like, I'm staying here, right? I'm in this job. And so I'm now, I am Minnesotan, right?
That you are.
Right?
You're putting down roots.
I'm putting down roots. And so, as a physician and as an academic, you do a lot of training, you do a lot of moving. But I am putting down roots, and I am committed to this community for population health and all the things that I've always been. But things have to get better in Minnesota also for my little person, right, growing up here.
That they do. I think that's a sound way of looking at things, and I think it really speaks to who you are as a whole person. So thank you for sharing that. Is there anything that you would like to communicate to our viewers or to the public that we have not already shared that you think is very important as we gear up for fall, not just the school year and the cold temps? We won't say the S word on this show because it'll come if you call it. So,
well, I think the thing about fall that we have to just be mindful of and cautious of is that over the last couple of years, when we've had a COVID surge, it's been in the fall. And we still have a lot of opportunities to get individuals vaccinated. And so I look at the data, the COVID data, the vaccination data by race and to some extent by ethnicity every week. And we have an opportunity to close some gaps. And so I definitely have to give the message that if you are not up to date with your vaccinations, I'm going to say, please go get those. We still have some state sites operating, particularly right now at the Mall of America, operating, giving vaccinations. Please go get those. Go get those shots. Get up to date with your vaccinations, not only just for COVID, but also for any vaccinations, particularly for the little people that have been missed over this time.
Can you share with me some of the direct work that has been done around COVID with you guys' specific department?
Thank you. Yes. So I come into MDH, and what I was so pleased to find coming in as a new employee, as an assistant commissioner, was how the department and the Bureau specifically has made more connections to community-based organizations as part of the COVID response, right? And as I said, MDH is a good place for convening, right? We do have a lot of very talented, very smart folk, but a lot of the solutions to health disparities and to ways to address the COVID epidemic are out there in community. And so what we did, we have COVID community coordinators, which are community-based organizations that are connected to many of our focus communities. So whether they be multi-generational African American, whether they be newer African American communities from the African immigrant diaspora, Latinx, LGBTQ+. And so we have a number of partnerships. And I really am really proud of our CCCs, our COVID community coordinators, as well as our community liaison team, as well as our diverse media contractors who have those connections to really do the outreach and to bring that information back to us so that we know how to best shape our response. So that team has been, it's a lot about people power. It's about relationship. It's about connection. And I'm really proud to now have joined that group and to facilitate their good work.
It sounds like you guys are doing some really amazing work over there, and I'm excited to not only continue the conversation with you and the Department of Health, but also to see what comes in the next 6 months from the Health Equity Bureau, because I think it's going to take a while to not only for them to encounter the Dr. Cunningham effect, but also to see all of the legwork that's actually going to take place that's going to be very transformative for our community. So I'm going to stay tuned. I don't know about anybody else, and start following the social media handle so I can keep up to date as to what's going on with the Bureau. Thank you for joining me today. I just wanted to send a special shout out to the Minnesota Department of Health and the Health Equity Bureau, as well as your lovely communications team for all their assistance on this interview, and I hope it is the first of many.
Me too. Thank you.
Unfortunately, that is all the time we have today. A special thank you to Dr. Brooke Cunningham, Clayton Bradbury, and the rest of her amazing team at the Minnesota Department of Health, and a special shout out to her team at the Health Equity Bureau for their time today and all of their support on today's interview. I hope something said today you found informative, you found inspiring, or educational. Thank you for joining me, and I hope to connect again soon.